Back in this Friday as the makers of Ozempic facing a proposed class action lawsuit that alleges the company has not properly warned Canadians about severe side effects. For more on this, we are joined by Dr. Iris Gorfinkel. Dr. Gorfinkel, good morning to you. And this BC lawsuit claims the company was negligent. What exactly are the claims here and the risks that are associated with using Ozempic?
So, an article in the Journal of the American Medical Association pointed out that people who take Ozempic are actually at an increased risk of having paralysis of the stomach. Food can get stuck in the stomach. That's partly the way it works. But unfortunately, that has a fourfold increased risk of happening. And on top of it, intestinal obstructions can happen. And that's a problem as well. So unfortunately, in the product monograph, the company failed to inform both clinicians like me who would be reading such a thing to learn about the drug and users of the medication. Now, it still has its tremendous advantages in diabetics, but this was excluding diabetics. This was talking about when it was used for weight loss specifically.
So Ozempic, as we know, was approved by Health Canada to treat diabetes. So could they be liable for people using it for other reasons, such as weight loss?
Yeah, great question. Because Ozempic is actually the very same medication as Wegovy. Wegovy was specifically approved by Health Canada for weight loss, whereas you're right, Ozempic was only for diabetes, but it's the very same medication. Semaglutide, same active ingredient. So what's the difference? The difference is only in the dosing. And in fact, Ozempic can go up to 2 milligrams once a week. It is an injection. But Wegovy starts at 2.4 milligrams. Slight difference, but very same drug given the same way and the same frequency.
All right. Meanwhile, also making health headlines, Dr. Gorfinkel, Brooke Shields, after revealing that she recently had a seizure and actually woke up in an ambulance with Bradley Cooper holding her hand. Doctors are saying her seizure, Dr. Gorfinkel, was caused by low sodium?
A tale of warning. So this is her, what I gather from what she experienced. Somebody said, gosh, Brooke, you don't look very well. And she recalls feeling confused. The next thing she says, I felt like I was blacking out. My hands dropped to my side. And then, her words, I went headfirst into a wall. That's what she describes. So this is because her sodium turned out to be low. And she admitted she was drinking a lot of water. That, I guess, is the model's life. Unfortunately, we have a long way to go, us feminists.
Yeah, I hear you. We always hear you have to drink more water. I know I have to drink more water, but can you drink too much water?
Absolutely. And let's follow what happens when a woman exceeds generally about 2 liters of water. Initially, that water, we swallow it, goes down into our intestine. If it's not all absorbed, it can turn into diarrhea. But of course, most of it is absorbed, and that dilutes our sodium. And that diluted sodium goes to the brain. And it can, if it's bad enough, cause confusion and seizures, which is what happened to Brooke Shields. Now, what happens if it goes into the extremities? A lot of that water winds up in our hands and feet. People come to see me as a GP. They ask, why are my hands and feet so swollen? I'm like, how much water are you drinking? And sometimes, you wouldn't believe it, I saw a woman last week, 4 liters of water. That's what she's drinking every day because people have this notion it's good for them. Of course, they're peeing all the time. Even their carpal tunnel can get bad because, of course, all that fluid puts pressure on the nerve. So it has a lot of unexpected effects.
Interesting. All right. It's Movember, which, of course, raises awareness about men's health. And when it comes, Dr. Gorfinkel, to prostate cancer, the University of Alberta has developed an exciting new blood test which may actually reduce the need for unnecessary biopsies, we hear.
This is so exciting. Imagine the PSA as it stands now. The problem is that it doesn't tell us which men are going to have high-grade, more worrisome tumors versus low-grade, tumors that really should be ignored. So what winds up happening is men wind up having a lot of biopsies to find the very few who have high-grade tumors. So the researchers combined the PSA along with other prostate biomarkers of cancer in their blood, along with, get this, machine learning. And it used their clinical information, their personal clinical information, and was able to predict with 95% accuracy those patients who would have the more worrisome type of tumors. And they reduced the number of biopsies needed by 35%. So it's a step in the right direction and hopefully a harbinger of great things to come in medicine where we can reduce unneeded biopsies.
For sure, for sure. All right, quickly, this weekend, the clocks for most of us fall back. For those who have trouble adjusting to the time change, any advice?
Yeah, avoid caffeine and alcohol. The Sleep Foundation found actually that there is a slight uptick in people's reliance on caffeine and alcohol during the time change. So the best advice, caffeine, of course, is a stimulant, and alcohol disrupts sleep significantly. So go to bed at the same time, wake up at the same time, same old sleep hygiene. And of course, the other tent poles of wellness matter a lot. Good diet, exercise, because that improves both the quality and the quantity of sleep.
All right, some great advice as many of us get set to fall back this weekend. Dr. Gorfinkel, good to see you as always. Have a great weekend.
All the best.